My name is Jennifer White, and I am a licensed practical nurse in the baccalaureate program at Indiana State University. This is my fifth health education project in the spring of 2021 for Community Health Nursing Class 444. I will be discussing correctional health care. By the end of this presentation, the participant will be able to 1. Define correctional health care. 2. Identify the barriers to health care for misdemeanor criminals. 3. Identify the barriers to health care for felony criminals. And finally, understand barriers between healthcare providers and security staff. Please pause the video here and take the pre-test listed in the comments below. As of 2019, there were 2.3 million people incarcerated in the United States, according to Solel and Smith, 2019. Many of these people have issues with mental health, substance abuse, and acute or chronic medical needs. These chronic needs include congestive heart failure, hypertension, diabetes, and chronic kidney disease, just to name a few. Mental health issues include depression, bipolar disorder, anxiety, and paranoid schizophrenia, along with a host of other diagnoses. Many of these conditions require long-term, routine health care to include medication maintenance and laboratory results. Correctional health care is about taking care of those who find themselves in jails, prisons, or federal holding facilities. There is data stating that only about 0.5% of nurses with a baccalaureate degree are employed by the correctional facilities. This number does not include medical assistants or licensed practical nurses. Many of these facilities are underfunded and understaffed, so quality of care is a definite issue. Solel and Smith, 2019. For people who are incarcerated, obtaining health care is a difficult and oftentimes irregular occurrence. For many people that are arrested on misdemeanor charges, there are certain barriers to obtaining health care. Many misdemeanor charges are related to substance abuse, so the first barrier to care is non-compliance by the patient. Many of these patients are more concerned with obtaining their next fix, whether it be drugs or alcohol, and are not obtaining adequate health care for themselves. The second barrier is that many people who commit petty or misdemeanor crimes are those with a mental illness that is going untreated because of a lack of mental health hospitals in the United States. Many of those with mental health issues self-medicate with drugs or alcohol, which can lead them to committing crimes. Once these people find themselves incarcerated, they don't seek medical help from the staff of the facility because they will only be there for a day or two, so why bother? Many correctional staff don't acknowledge a medical condition for the same reason: short duration of stays. Of course, the reverse is also true. Some people commit crimes so they can go to jail and obtain free medical care. Correctional nursing, according to Solel and Smith, 2019, are the first healthcare providers that many inmates see. So the nurses are the vital link between the inmate and the healthcare system. Correctional nurses perform full health assessments, administer medications, provide routine management of acute and chronic illnesses, and provide emergent care as needed. They must also act as the advocate for their patients both during incarceration and after. Felony criminals have the same barriers to healthcare as misdemeanor criminals, but they also have the added problem of nurse or security staff bias. Many of the crimes committed by felons include murder, rape, armed robbery, and child abuse. It is difficult for healthcare staff and security staff to put aside their prejudice and stay unbiased and to not treat these patients differently. There is also the problem of patient confidentiality. Most jails and prisons house their inmates in shared cells or even dorm-type rooms with little to no privacy. So this can lead to inmates being discriminated against by their own roommates because of a medical diagnosis such as AIDS or mental health issues. Correctional healthcare workers are a breed apart. They must have a very thick skin and be able to weather verbal and sometimes physical abuse from the very people they are trying to help. They must also be strong advocates for their patients to ensure that the security staff makes healthcare available after incarceration. People will do almost anything to obtain what they need or want. So correctional healthcare workers have to recognize when a patient has a true medical problem and when an inmate is just trying to get out of the housing unit. There must be better funding and education for correctional healthcare workers. Prisons and jail facilities should provide a designated area for the medical needs of the patients where confidentiality can be upheld. There must also be a good rapport between healthcare staff and security staff. Healthcare workers go into the medical field because they have a caring heart. In the correctional field, physical examinations of patients can be reduced due to the risk of injury to the healthcare staff, and this can also lead to healthcare bias against the inmate. Even the best of healthcare workers can become jaded, and knowing a patient's criminal history can interfere with the care that is provided. Correctional healthcare workers must actively and consciously monitor themselves for bias and prejudice and work towards maintaining a caring healthcare program for incarcerated individuals. According to Salell and Smith, 2019, correctional nurses refer to themselves as fair, firm, and consistent.